So welcome everyone to the 7th TIA Centre seminar of the academic year. So my name is Adam Shepherd and I'm a postdoc here at the TIA Centre. And today I am delighted to introduce Tong Ding. Tong Ding is a second year PhD student in computer science at Harvard University and Brigham and Women's Women's Hospital, working with Professor Faisal Mahmood. His current research focus is on developing multimodal foundation models for computational pathology. Before this, he received his master's degree in computational biology at Harvard University. It was also advised by Professor Faisal Mahmood. And the title of Tong's talk today is Multimodal Whole-Slide Foundation Models for Pathology. So Tong, thank you very much for joining us. And whenever you're ready, please feel free to start.
Yeah, sure. Thank you. Thanks for having me, and thank you for your introduction. And as many of you are already familiar, unlike natural images, histopathology whole-slide images can be as large as 150 by 1,000 by 150,000 pixels. And the right-hand side depicts a cross view. Cross view of the whole slide, from which we can magnify and zoom into fine-grained details such as tumor and immune cells, which are important in slide-level tasks such as cancer diagnosis and prognosis. And due to the large resolution of the whole slide images, instead of directly processing the raw images, the current paradigm for computational pathology follows a multiple instance learning approach, in which we segment and tile the tissue regions into non-overlapping patches, typically of size 256 by 256 at 20x magnification, and followed by feature extraction using a pre-trained patch level encoder. And so we can represent the whole slide as a bag of frozen features, greatly reducing the computational burdens. And using the task labels, we can then train an aggregator, or say a slide encoder here, which aggregates the bag of patch level features into a slide level feature, and then a predictor is used for task prediction. And currently, the focus of foundation models is mostly on the feature extractor part. But the current paradigm has several limitations. First of all, the use of 256 by 256 patching has limited context, and it poses a very large number of patches for training the aggregator. And for the current aggregator, where people normally use, commonly use attention-based multiple instance learning methods, which is like permutation invariant. So there's no commutation between instances, and these models are typically trained from scratch, where number of parameters is greatly larger than training data points for these downstream tasks. And as a result, the trained slide level embedding is then task specific, and such a training method is typically unimodal only and does not utilize complementary text or genomics information. So given the slide level nature of pathology images, we wanted to question if the current patch level foundation models are really foundation models for pathology. On the one hand, they indeed achieve substantial improvements as compared to the use of out-of-domain trained models like ResNet-50, for example. For example, like UNI model that is commonly used, foundation model from our lab, achieved state-of-the-art performance on various tasks, including ROI level classification, retrieval and prototyping, ROI level segmentation, and slide level classification using ABML. And as you can see that the performance increase is quite substantial compared to the performance from the use of ResNet-50, for example, on the challenging 108-way uncle tree code classification tasks created internally from the Brigham and Women's Hospital, the performance increase can be greater than 30%. And if you look at the challenging brain tumor subtyping tasks from eBrains, the performance increase can be more than 40% already. However, and also as a further step, we can align these models to text so that we can build models like PLEP or Conch from our lab to enable zero-shot and cross-modal search capabilities. And even more, we can do captioning at the patch level. And but still, we still need like techniques like IMI0 or other techniques to make it possible for slide level. So we wanted to question like, what is the next step for a slide encoder? First of all, we want to accumulate patients across different tasks and diseases with the use of unlabeled slides, where we shift from the use of disease or task-specific datasets to diverse datasets of neoplastic, infectious, and inflammatory cases. And secondly, we want to shift from task-specific supervised learning to self-supervision with images and further with medical text and/or genomics. And therefore, our ultimate goal is to then have a pre-trained general-purpose slide encoder that produces off-the-shelf slide-level features that can be used for various downstream tasks without any task-specific fine-tuning. There are a couple of existing pre-trained slide foundation models. The first one is GigaPath, and that's published on Nature about like half a year ago, which use like mask autoencoder to pre-train this slide encoder. And specifically during pre-training, the model predicts the masked input tokens. Such training methods focus on local information without training the global COS token. While demonstrating decent performance with fine-tuning, this method is known to be not work that well under the simple linear probing setting. That's like sort of like conflicting with our purpose of having a off-the-shelf useful slide level features. And the next one as Chief is also more recently published on Nature. It adopted a self-supervised supervised contrastive learning approach that predicts cancerous versus non-cancerous on around 60,000 data sets. And the last one is PRISM, which perform specimen report level contrastive learning. So different from this previous approach, we seek to translate this previous success from our patch level training, which uses dino-like methods followed by vision language alignment as demonstrated in Conch, to slide level. So to this end, we introduce Titan. Titan is a vision language foundation model that scales the multimodal capabilities of Conch to the whole slide. So Titan is trained with more than 340,000 slides with generally say 2 stages, with the first stage from the unimodal pre-training, similar to what we did for Conch, where we use iBot pre-training methods to pre-train the vision encoder, and followed by alignment with language. And here we use 2 stages of language alignment. The first one being aligning with synthetic captions by PathChat, our multimodal AI copilot for pathology built from our lab. And followed by alignment with the real pathology reports at slide level. And at the last, there is no fine-tuning required to extract general purpose slide representations. So more specifically, we start from our stage 1 training details. To use the previous like patch level training methods like Dino-like training methods, such methods require square like input, but most of these slides are typically in regular shape, and when training at slide level, we have much less, like very limited sample size as compared to patch level model training, where people can easily do like billion scale image size. And also the large image size here makes that hard to be modeled. So we propose several like strategic ways to handle that. First of all, we can do a random cropping from the whole slide into a, for example, like 8,000 by 8,000 large ROI regions from the slide. And we can view our patch level encoders as essentially a tokenizer for this large image. So it's like similar to our patch level training, where in the vanilla vision transformer, we use a patch size of 16 by 16, and we use an embedding layer to embed that 16 by 16 pixels patch into a token as the input of our transformer layers. And here, we do exactly the same, except that we use a pre-trained patch level encoder as our tokenizer here, and it is frozen during training. And so that in the same way, we can encode a 8,000 by 8,000 ROI images into a sequence of 256 tokens. So it's like 16 by 16 at every edge. And in this way, with a square like input and with these like 256 tokens input into vision transformer, we can do exactly the same training for Dino-like training methods. So more specifically, here we used ibot, which is consisted of like two loss. The first one is the student-teacher distillation loss, and the second is the mask image modeling loss, with the objective of being reconstructing the tokens in this like feature space. And even though we are training at this like smaller ROI level, we adopt like the philosophy of train short, test long, inspired from how people build large language models, where we train on shorter sequences, or so say shorter sentences. But at inference time, we can just use the model and apply it to like a document level data. So here we can train and at this like 8K by 8K level ROIs, but inference at the whole slide level. And another strategy we use is to tokenize the slide with 512 by 512 patch features. This not only enables us to view like more context at the patch level, it also reduces the complexity of the positional embedding by 4-fold. And in addition to that, to learn the context between the patches here, we use positional encoding called alibi, which was originally proposed for large language model training. And it is known to work well under the circumstances of extrapolating your sequence length to a longer sequence at inference time. And okay, then going beyond that, to enable our models multimodal capabilities and to continually pre-train Titan with language alignment, we first pre-train Titan with captions generated by PathChat at this like AK by AK ROI level. So then in this stage, what model sees is sort of like the same as our first stage vision training. And here we generated more than 420,000 fine-grained synthetic captions using PathChat. And we use these synthetic captions to further pre-train Titan using the COCA training approach, where we also have two loss terms. The first one being the contrastive loss between the image features and the text features, and the second loss being the captioning loss from generating the reports. And
Hi, Tom. Can I ask a quick
these
question,
methods,
please?
yeah, sure.
We've got a couple of questions actually. So first of all, I suppose my question is, how can we be sure that how accurate the these ground truth labels that we're getting from PathChat are for these ROIs? And we have got a second question in the chat, but I'll wait to answer that one first.
Oh.
So we got regarding so I suppose my question is regarding using outputs from PathChat at the ROI level. I know you've got these pathology report level actual ground truth. Then you're using a combination of the pathology report and these ROI level, these ROIs to get these with PathChat to get the ROI ground truth.
So when we were using PathChat, what we gave PathChat was the tissue site of the slide, but we didn't give or like the diagnosis or label of the slide because we don't know if this region contains tumor or not. And we actually like generated like a bunch of like we randomly sampled a bunch of like AK by AK regions and generate the captions. We ask our pathologists to check the quality of PathChat generated captions, and overall, it's kind of like there is, of course, like hallucinations there, but the overall quality is acceptable to pathologists. And as we can show later, that these training with synthetic captions actually helps the model's performance.
That's brilliant. Thanks, Tom. We've also got a question from Mustafa, I think, on the chat. He said, "How are the 8K ROIs selected? Is it
right?" So yeah, this is a good question. So we didn't do like anything like fancy. Here we just simply randomly sample these like AK by AK ROIs from the slide, and as long as it contains tissue. Yeah.
Thank you.
Yeah, and so this method gives us like several benefits. First of all, is that is scalable as compared to the use of pathology reports. As long as we have the slides, we can generate as many of as these like captions as we want, and generating captions at this AK by AK level gives us more samples at training. So it also enables larger dataset training in contrast learning, because encoding these smaller images during training is more computational affordable. And so yeah, going beyond this stage, next we tried aligning Titan with real pathology reports. And so here we collected more than 180,000 paired pathology reports, which is a subset of our stage 1 training. And here we demonstrate actually a slightly like a better performance as compared to using synthetic captions only. And furthermore, instead of using either stage 2 or stage 3, in the actual Titan, we can use a combination of stage 2 and stage 3. And in this way, it demonstrates like the best performance compared to these two baselines. Yeah. And before we go into the models evaluation, we first introduce like two benchmarks we created. The first one is TCGA uniform AK dataset. This dataset is a pan-cancer subtyping dataset at region level, consisting of more than 250 AK by AK cancer regions from 9,600 H&E FFP slides from TCGA. And the tumor regions were manually annotated by our expert pathologists, our collaborators from University of Tokyo, and approximately there are like 3 representative tumor regions per slide were annotated with pixel level contours like this. And for each contour, we send across a AK by AK region in order to contain both the dense tumor and surrounding tissue context. And we made a site-preserving splits of this dataset into train, validation, and test. And we will release this data for research use soon. And I wanted to know that, so the creation of these datasets has like multiple purposes. First is that because our model was trained at AK by AK level, we wanted to test also on the 8 by AK by AK level before evaluating on the whole slide level to see if our self-supervised training is successful. Besides that, this is also a very valuable data set for evaluating those slide level models because a AK by AK size is already impossible for patch level model to encode. And this turns out to be actually a very challenging data set, as we will see later in our evaluation. And the second benchmark is called TCGA encode tree. It is a 46-way encode tree code classification task consisting of about like 11,000 FFP slides from TCGA. And we purposely made this like dataset for to create like a challenging large representative benchmark for assessing performance of these self-supervised learning trained encoders. And all of the splits are created for like preserving their source site of TCGA, and they are already made available in our GitHub. All right, and so
sorry, can I ask a quick question,
yeah.
Tom?
Sure.
So in the TCGA datasets, both TCGA encode tree and the previous one, did you use both the frozen section slides and diagnostic slides, or are these only based on diagnostic slides?
Yeah, thanks for your question. We used FFP diagnostic slides only. We didn't use any frozen slides.
All right, cool. Thank you.
Yeah. Yeah, and so now we start to investigate the model's representation qualities, and so we first to visualize different slide encoders embedding on the TCGA OncoTree datasets. And we can observe that both Titan and Prism embeddings were nicely separated along organ size, whereas GigaPath or Chief resulted in a giant cluster lacking separation. And this was very impressive given the fact that the pre-training dataset for Titan did not include any TCGA slides. And also it's nice to observe that some closely related organs are also closely visualized in this plot. For example, stomach and bowel are clustered closely together in this plot. Yeah, and next we evaluate Titan under linear probing on this diverse set of tasks, including morphological classification, molecular classification, and survival. In morphological classification, we identified 4 challenging tasks, including our TCGA uniform tumor AK dataset, TCGA OncoTree dataset, and the 108 way rare pan cancer dataset subtyping tasks we created internally from the Brigham and Women's Hospital, and also the 30 class classification task from eBrains. And just note here, all of the 30 subtypes of the brain tumor in these datasets are considered as rare cancers according to NIH guidelines. And as we can see the comparison here, that Titan outperforms other baselines by a large margin on all of these tasks, not limited to these challenging multi-class subtyping datasets, but also on the traditionally used BRCA, RCC, NSCLC subtyping datasets. And we also evaluate the models and several non-cancer datasets, including HER transplant rejection prediction or renal transplant rejection prediction, and also other more 38 tasks, molecular classification, and also the survival prediction on TCGA. And to investigate more of the behavior of Titan, we compare Titan with mean pooling of the patch encoder and ABML baselines, and our fine-tuning using the average of these 4 challenging datasets to investigate that. So as compared to the supervised ABML baseline, Titan outperforms it using only linear probing, and we see that not all slide foundation models can outperform their ABML baselines. With our model, with Conch V1.5, our patch level models plus ABML outperform other slide foundation models by actually a large margin. And further, we compare Titan linear probe to mean pooling of patch level features also in the linear probe. And we also see that not all slide foundation models can outperform mean pooling baselines. And here we also want to highlight that the mean pooling baseline can be a very strong baseline in slide level evaluation. And next, we wanted to compare Titan linear probe with fine-tuning the same slide encoder architecture, but trained from scratch. And we show that pre-trained Titan outperforms other baselines, this end-to-end fine-tuning of the slide foundation model architecture. And also, not all of the model can outperform their end-to-end supervised training like baselines. And finally, we show that fine-tuning of our pre-trained slide encoder further improves like Titan's performance. And next, we wanted to investigate the efficiency of pre-training data usage and scaling loss. First of all, we demonstrate that even with the usage of around 40,000 slides, Titan can already outperform other models trained with much more data, such as more than 500,000 slides already. And while we scale our data to larger scale, we see a improvement on these downstream tasks. And furthermore, aligning with text improves the vision owning performance by quite a bit. And next, we investigate the algorithm design considerations when we build the vision owning first stage pre-training. And we gather several insights from that. The first insight is alibi positional encoding shows effective contextualization of hash features, helping Titan extrapolate effectively to the entire slide, and which is better than the use of commonly used absolute positional encoding, no positional encoding, or the rotary positional encoding. Our second insight is that for training a slide level encoder, a larger model is not necessarily better than a smaller models, and we show that a 6 layers vision transformer can be good enough and better than a larger 12 layers vision transformers. And lastly, we show that the vision pre-training is necessary for more successful vision language alignment, as shown in the comparison of using all of the 3 stages as compared to use the last 2 language alignment only. And next we investigate Titan under few shot settings, where we vary the number of data, number of samples per class from 1 to 16, and we show that again Titan presents the overall best performance as compared to other models, and shows data efficiency, especially under low shot settings. And in some cases, for example, TCGA encode classification, using 1 sample per class, Titan can already be better than other models using even 16 samples per class. And with a model that can readily produce a general purpose. Oh, I see a question in the chat.
Yeah, we've got a question from Mustafa in the chat who's asked, can you briefly explain how Alibi does position encoding that makes it more powerful than other approaches? Yeah, sure. This is a great question. So Alibi is a little bit different from also the traditional position encoding. Alibi is more like attention bias added to the calculated attention score. So more specifically, it penalizes the attention score from 2 distant tokens, but encourages the attention score between 2 close tokens. And here we use the Euclidean distance between 2 patch tokens in the grid. And
it basically calculates this like Euclidean distance and add that to like we use the attention score to minus that distance and use that as our new attention score. So sort of like the attention score is penalized by the distance between two tokens.
Thanks for explaining that, Tong. Don't think we've got any more questions.
Yeah, you have any more? Okay, I will continue then. Yeah, so with a foundation model that can readily produce these like general purpose features, a very nice clinical application we can do is then to use these like slide embedding slide foundation models to do rare disease retrieval. And here we propose two datasets. The first one is called Rare Cancer Public Datasets, which have the slides from TCGA and IBRAN's datasets. And it consists of like 127 subtypes in this dataset. And further, we propose a rare cancer dataset that has 5,000 more slides from the rare cancer public datasets from our internal source, and to make it a large dataset of 19,000 slides spanning like 143 common cancers and 43 rare cancers. And to mimic the clinical workflow, or for example, like when a very hard to diagnose case come, or a very rare cancer case come, a clinician might want to retrieve a similar slide from the database and to see the diagnosis of this slide, or say to see the report of this slide. In our case, in our benchmark, we use these like 43 rare cancers in our query set, and our support set has all of these 186 subtypes cancers there. And in this task, in both of these like data set that has our internal data or the public version of this benchmark, Titan demonstrates favorable like performance as compared to other models as well. And it also gives us some very like interesting like clinical findings here. As shown here, we use a paraganglioma as an example here. So while retrieving from the large database of these like 19,000 slides, the highest similarity score is achieved from another PGNG slide. And a very interesting finding is that another very like high similarity score is obtained from a slide from a pheochromocytoma slides, achieving a similarity score of like 0.65. And this actually agrees with the literature that both of these like cancer types are morphologically tightly connected as rare neuroendocrine tumors. And further to that, we also benchmark more commonly used like data sets using these like retrieval systems, and still like Titan demonstrates like favorable performance as compared to other models. And besides these like unimodal capabilities of Titan, the vision language alignment further enables us for like training-free clinical diagnosis using like zero-shot classifications, where we use like a template to formulate our labels as like, for example, like an example of glioblastoma ADH wild type, and we use our slide encoder to encode our slide into the shared feature space, and then we can calculate the similarity score between a slide and a text description. And in this zero-shot paradigm, Titan also outperforms other models by, in some cases, like very large margin. And in some cases, Titan's zero-shot performance is on par or even better than linear probe already. For example, these like NLC, LC subtyping tasks, Titan can already do like a greater than 0.98 AU-ROC. And for example, on RCC subtyping task, Titan can already do like greater than 0.96 balanced accuracy on these tasks. And further to that, the vision language alignment also enables a cross-modal search, where we use the TCGA slide level reports and the TCGA slides to perform this like cross-modal search. We embed the slide level reports using our text encoder, and we embed the slide using our Titan slide encoder, and then we perform retrieval in this like shared vision language space, and we show that Titan can accurately retrieve the report that has the correct diagnosis and demonstrates better performance as compared to other models. And further to that, thanks to the COCA training objective, Titan is also capable of doing captioning for the slide. And we evaluate this on the TCGA datasets as well. And we calculate several natural language processing metrics using the ground truth TCGA report and our generated reports, and Titan also demonstrate better performance than other models. And as a side note here, we will also make our processed TCGA slide level reports available. It was built on the previous efforts of OCR, the TCGA case level report, and we further process it into slide level report. Okay, so what's next? So first of all, we of course wanted to further create a larger slide owning datasets from our in-house source to further scale our vision only model, as we see the very promising scaling law there. And second, we wanted to leverage the scalability of synthetic caption generation using PathChat to further scale our synthetic caption datasets for our stage 2 training. And furthermore, we will collect more paired clinical reports for our third stage training. And okay, that's probably all of our Titan presentation. But as another exciting news, we will be, as many of you have been using our Uni model for a while, and so we are very excited to say that we will be releasing Uni 2 model tomorrow. So please stay tuned. Okay, so at the last, I would like to acknowledge my amazing collaborators and Sophia, Andrew, Richard, Max, and Long. Also, a great thanks to my advisor, Faisal Mahmoud. And without their support, this project can never be possible. Yeah, thank you.
Thank you very much, Tong, for a fantastic talk. And that's, again, really well done, this brilliant work. And it's great to see that Uni 2 is coming out tomorrow as well. I know in our lab, everyone's already using Uni, so that's brilliant to see. So I suppose with that, we'll open up the floor to questions. Does anyone, either online or in person, have any questions they'd like to start with? I know there's a couple online already. Does anyone in person want to start? Or sure. So online, we've got a question from Muddy, who's asked, in previous slides, you mentioned Titan requires less number of layers for encoder training. Does that mean the dataset compiled for training Titan is not comprehensive enough that overfits with higher number of layers? Did you get that question? Sorry, Tong.
Yeah. So I'm going back to that slide. Does that mean the dataset compiled for training Titan is not comprehensive enough that overfits with? I actually don't think so, because I think the training at slide level is easier than the training at patch level, where we need to process the raw pixels. Here at the feature space, especially when you have a very strong patch level encoder, the training is actually getting easier here. And we actually did like several like experiments on this, like even before we officially start this project, we observed that using a small model actually is like enough for the slide level training. And also, if you know the very early work like HIPT model from Richard from our lab, the second layer and the third stage vision transformer in the HIPT paper is also a very small vision transformer model. It's like a 3 layers vision transformer, and that works pretty well already.
Thanks, Tom, for that great answer. And I hope that's answered your question, Marty. So I've got another question. So just want a sort of brief answer really from you in terms of, at the moment, we're seeing so many different foundation models in pathology that we've got all sorts, even just in the last sort of 6 months, we've had at least sort of 10 models released. I just wanted to, if you could just very briefly describe to us why Titan's different to, say, Chief and Prism, and why it's better.
I would say that, so first of all, I think the field of slide foundation model is not currently as popular as the patch level foundation model domain, where we have probably more than like 50 patch level foundation models already in the field. And so in the field of slide foundation model, I think right now, like many of the methods are still like some like early efforts like trying to do it. And many of the previous models like GigaPath or Chief were actually not designed for linear probing use. It's mentioned like very explicitly in, like, for example, like GigaPath paper that, our pre-trained slide encoder is for fine-tuning use, and our pre-training just makes your fine-tuning perform better. And Chief also the same way in their evaluation, and also we also asked them on their GitHub issues, and they said that, Chief is actually also not built for linear probing use. Is mostly for fine-tuning. And so here our efforts is mainly for like producing a model that can produce off-the-shelf usable slide features that can be used for various downstream tasks.
Thanks, Tong. So we've got a couple more questions online. So Lydia's asked, said, thank you for your presentation, and has asked if Conch version 1.5 is publicly available. I don't suppose you know the answer to that.
It is publicly available. So it is available via our Titan hacking phase, and we have very detailed instruction of how to load Titan model and how to load Conch v.5 models.
Oh, that's brilliant. Thank you. Does anyone in person have any more questions? I know Mustafa's got a question that he's waiting patiently to ask.
I have a quick one. So could you explain briefly why you chose Conch v1.5 as opposed to another patch encoding model? Is it mainly because Conch is trained in a kind of vision language setting, and this model is designed to be a vision language slide foundation model? So it kind of made the alignment, the vision text alignment easier, or is it some other reason?
Yeah. So yeah, it's kind of like the reason. It is because like Conch is like, as you mentioned, like aligned with like text already. And also our Titan text encoder is actually initialized from Conch text encoder weights. And so yeah, so that way makes like our slide level alignment more easier. But probably in our next iteration training, we will probably try to use our Uni V2 model, and hopefully it can give a like even better performance.
And I guess just a quick follow-up question on Uni 2, what changed between Uni and Uni 2, I guess?
What is the difference between Uni and Uni 2?
Yeah.
Yeah. So Uni 2 is a VIT huge model with patch size 14. It was trained on much more slides compared to Uni. Uni was trained on 100,000 slides, and Uni 2 is trained on 350,000 slides.
Thank you.
Thanks, Tom. And I know Mustafa's dying to ask a quick question online. Mustafa, do you want to type it out, or do you want to speak on the microphone?
I can speak. It might not be a quick question though. I have one quick question first. First of all, thank you very much, Tong, for the great presentation. Really enjoyed learning about your work. It's really comprehensive, and I really thankful because you making lots of it also publicly available. So the first question, really quickly, is that what if while you're talking about the encoder, the patch encoder, because you posing this as foundational slide level, model, would it work if you use another patch encoder? Say if you use Uni feature extractor, have you tried how the performance changes?
I would say that, so we didn't try that, but I would say that it won't work that well because the embedding space of Conch and Uni features are very different.
Very different.
I would say.
I would expect so
like,
too. But like a follow-up question would be, do you think when you're thinking of continuing this work, do you think there can be an approach that makes this Titan, new version of Titan, agnostic to what kind of features you're extracting?
Yeah, I think that would be very interesting. I think because like all of these like patch embedding models produce like very different embedding space. I think maybe a possible approach is to train a projector that projects the one model's embedding space to the embedding space that Titan requires. And hopefully that training is light and affordable on like a very small amount of data and not much compute resource.
Yeah, it would be nice to see how does it work. So my next question, if time allows, is these are not the kind of question we usually ask, to be honest, but I think it's a great question to ask you. So it is a very comprehensive piece of work. It has so many experiments with it, so many good results, so many open source codes and data sets, right? So the question that I want to ask is about the workflow that you guys have gone through to make this work, right? So for example, how long did it take you? I know it's a group work, of course, it's a team work. You had collaborators to help you, but I also suppose you were the main contributor to the work as most of research works, at least in our group. So how long did it take you to put all this work together?
I would say we actually started like investigating this approach very early. I would say like in 2023, we started exploring this direction. Although we didn't really like do full time on this like research until early 2024, like around like April, we have a team of people then doing full time on this project and pushing on all of this like workflows. So we didn't really like spend that much time on like the model development. I would say like most of the time was spent on like evaluation and finding like interesting applications of the model. For example, like the rare disease retrieval task and creation of other like benchmarks like TCGA encode tree classification, like TCGA uniform tumor, yeah, things like that.
Interesting. So I guess that also brings me to well, you kind of answered it. I was about to ask, what was the most challenging part of your work? What was the moments that you say, this doesn't work, or like bother you the most throughout this 1 or 2 years of research doing this?
Let me see. Because almost every part is pretty headache. So
True.
I think one of the part is like what's the best way to show off the model's performance, like how to distinguish it from other previous like slide foundation models, and so that we'll have to like curate those like rare disease retrieval data sets. We'll have to find those those like challenging tasks to evaluate on, and yeah.
Yeah, makes sense. Well, thank you very much again, and thanks, Adam.
Thanks, Tom. Thanks for the split. I suppose
Thank you.
it's 3 o'clock, so you could probably draw this seminar to a close. But thank you, Tom, for a really fantastic talk and some great work that you've done there. So well done. And I would like to remind everyone else that our next seminar is actually next week. It's on Monday next week, Monday, 20th of January. We're joined in person by Professor Lee Cooper from Northwestern University from Chicago. But again, thank you very much, Tom, for some fantastic, for a fantastic presentation and some great work. And thanks everyone online and in person.